Thank you. Lynn Chapman, Lynnchapman, and I'm the State Vice President of Nevada Families for Freedom. According to KFF, an independent source for health policy research, polling, and news as of November 2024, had this information. Insurance coverage in Nevada, the employers cover 46.7%, Medicare 14.8%, Medicaid 20.6%, non-group 5.5%, military 1.6%, and uninsured 10.7%. Medical debt in Nevada was $220 billion owed in 2021. About 170,000 or 7.2% of adults in Nevada report having medical debt in a given year from 2019 to 2021. Total Nevada Medicaid spending in fiscal year 2022 was $5.6 billion. How many citizens, seniors, and veterans in Nevada need medical help or help in paying their medical debt? We should be looking after them. The people here illegally received help in programs such as WIC, emergency medical help, primary and preventative health care, at FQHC, which is federally qualified health centers, free breakfast and lunch shelters, soup kitchens, and emergency situations. Also, you have to figure in housing, education, jobs, and legal services. Who pays for all these free services? We, the taxpayers, who are the ones who have to shoulder the burdens of everybody else. We already have done our part in helping others. Federal money, state money, it all comes from the taxpayers. Vote no on SB 234. We simply cannot afford it. Thank you.
Thank you, Ms. Chapman. Please go ahead, sir, when you're ready.
Thank you. Good afternoon, Vice Chair and Committee. My name is Joshua Skaggs, and I'm the Legislative Affairs Director for the Nevada Republican Party, here in opposition to SB 234. Our platform states we support legal immigration from all nations, creeds, and races who assimilate, embrace the Constitution of the United States. Our platform further states we support securing the United States borders and effective enforcement of immigration laws. Allowing undocumented immigrants to access taxpayer-funded benefits, including Medicaid, undermines the principles of legal immigration and the rule of law. By extending Medicaid eligibility to undocumented persons, even if it's only persons under 21, we send a clear message that violating immigration laws will be rewarded rather than penalized. This creates incentives for illegal immigration, further straining our resources and eroding the integrity of our immigration and healthcare systems. SB 234 says that Nevada would seek federal funding to cover the cost, but that's a problem too. Medicaid is a crucial safety net for millions of low-income U.S. citizens, legal residents, and their families. Nevada may face challenges funding this program already due to reliance on temporary federal funding to pay for permanent expansion of the program. During COVID, Nevada agreed to transfer individuals between 100% and 138% of the federal poverty level from the Nevada Health Exchange, where the federal government paid for their health care, to Medicaid, where Nevada would have to pay. However, the federal government agreed to temporarily cover those costs. Now that they are looking to stop covering these costs, Nevada has to decide whether to find a way to pay for expanded Medicaid or change the rules to return these beneficiaries to the health insurance exchange, where subsidies would again be covered by the feds. Permanently expanding Medicaid to undocumented children and paying for it with federal dollars that may not continue could put us in the same situation in the future.
Mr. Skaggs, sir, you're at 2 minutes. Would you wrap up your comments, please?
Yes.
Thank you.
In the same situation in the future if federal funding stops, except that we'd have no way to transfer care for these children to the federal government. Please vote no on SB 234. Thank you.
Thank you so much. Please go ahead.
Thank you, Madam Chair and members of the committee. My name is Janine Hansen. I'm the state chairman of the Independent American Party. In our platform, it states that we oppose all tax-funded benefits for illegal aliens. I am very sensitive to the problem of cancer. My son has been extremely ill since last June. They had no insurance, no Medicaid, and now they have no breadwinner. He has a large family, and we have been fundraising, and family has been helping a lot. They celebrated his daughter's first birthday in March, and they celebrated that he was still alive. We don't know if that's going to be the case. So there is a lot of sympathy, and we understand. Medicaid spending in Nevada in 2022 reached $5.6 billion. Nevada spends $5,267 per year on average on each person enrolled in Medicaid. The average kidney transplant, for instance, costs between $400,000 and $500,000. We understand that this is just the beginning. Every bill in this legislature benefiting illegal aliens is always expanded in subsequent sessions. So this is just another opportunity to expand more services for illegal aliens. In a testimony before the U.S. Senate Committee on the Budget in September of 2023, Robert Rector from the Heritage Foundation said, "The current net fiscal cost of illegal aliens in the United States is between $84 and $94 billion per year. This means that illegal aliens receive $84 to $94 billion more in government benefits and services than they pay in total taxes." We are concerned about our economy. We're concerned about the high taxes in our state. 56% of every dollar that Americans have goes to federal, state, and local taxes, much of it hidden. We can't afford more in Medicaid for illegals. We can't afford more even for American citizens at this point in time. Thank you.
Thank you, Ms. Hansen.
My testimony. I appreciate the help that is given for vulnerable people, and I've heard good arguments that it may even reduce costs. However, my concern is this will create the incentive for more people to come into our country unlawfully. And, you know, hey, if you want to subsidize their health care, at least make the casinos pay for it. They have the lowest gaming taxes in the United States. And let me make this very clear. My main concern is the dirty politics behind all this, not the immigrants themselves.
I just want to oppose this bill. It's no good. It's not fair. I don't know if you guys know that these people use our ambulance services as taxi rides. And this is
Ma'am, I'm going to interrupt
from
you for just a moment.
all
We need your
from my-
name for the record. Can we just get your name for the record? Then you can go right back to your opposition.
Yeah, Lee. Yeah, Lee.
Okay, last name, please, or first name?
It's Deniger.
And if you wouldn't mind spelling that, you'll get all your time back. We just want to get the record straight.
Deniger.
Okay, ma'am. Thank you. Go right ahead. Thank you so much.
Yes, I'm in opposition of this because I don't think it's fair or right, and it's not even moral for these illegals to be using our taxpayer money to be getting free health care. Coming from my neighbors, and there's at least a couple 100,000 on my side of town. This is coming from them. They tell me they use it if their grandpa gets a stomach ache or one of their kids isn't feeling good. It's a free trip to the emergency room. You're seen first, and you're in and out of there. And I don't believe it's right. It's not fair. It's not moral. And I don't think the taxpayers ought to be paying for this. So I want to oppose this bill. And if you guys take that into consideration, everything that I said, I would greatly appreciate it. What's right is right, and we all know this is wrong.
Good afternoon, Vice Chair, members of the committee. Bob Russo for the record. I am in opposition to Senate Bill 234. Many Nevadans are struggling to make ends meet. The expansion of Medicaid to those illegally in Nevada will place a greater tax and financial burden on struggling families and individuals. And given that the expansion of Medicaid will likely exceed monetary resources, we could see a push to raise taxes in the future. Plus, this bill will stretch our medical resources thin and away from many legal Nevada residents that need them. We must ask ourselves sincerely if we want to follow California's lead and drive Nevada into financial ruin with bills such as SB 234. California has become financially unsustainable. As of the beginning of 2024, it was $76 billion in debt. They have spent almost $11 billion on indigent aid, mostly to people who are in the state illegally. And Gavin Newsom wants to borrow $3.4 billion from the general fund to pay for health care for people who are primarily in California illegally. The program in California is a financial downward spiral. The middle class is leaving in droves because they are paying the highest taxes in the nation. And what are they getting in return for it? More crime, high electric bills, poor social services, inferior roads and infrastructure, and below par schools. Once darling of the nation, California has fallen into a state of disrepair. It's the perfect example of how socialist policies lead to ruin. Again, is this the direction we want to see Nevada heading? Common sense says no, but this is exactly where Nevada is heading if we approve bills such as Senate Bill 234. So please vote no on this bill to keep Nevada financially sound, and so our resources can be directed to legal residents of Nevada who need them. Thank you very much.
Thanks so much. Thank you so much, Vice Chair Unauthorized. For the record, I want to dispel some misinformation that was spread throughout this testimony. So I just want to refute some of the claims that have been made. First and foremost, I want to start by thanking Ruby and Katia for sharing their stories. I think it's always important to highlight at least their scenarios. And what makes it so interesting is in Ruby's scenario, she is now a U.S. citizen that has to suffer as a U.S. citizen from the gravity of the resources that she was not offered when she was undocumented. Again, she is a Nevada resident, she is a taxpayer, and she has to deal with the ramifications because she was denied the coverage eligibility that SB 234 would have prevented. In the case of Katia, right, she was here legally. She's a DACA recipient. That is considered lawfully present. And so she was denied care as a 16-year-old for her cancer treatment. These are cases where individuals are here lawfully present, but yet they are still denied access to treatment for their particular diagnosis. And so I question this consideration that they are not taxpayers of the state. Are DACA recipients not taxpayers of the state? When they go and purchase food, not food from the grocery store, but when they go and they purchase items from the grocery store and they pay sales tax, is that not a version of being a taxpayer of the state? When they file taxes from the job that they work for here in the state, again, they are DACA recipients. Are they not considered taxpayers of this state? And so if the question is that we all agree that individuals who are here lawfully present should have access to the critical services, then I would expect my committee members to agree to commit to expanding Medicaid to individuals who are here lawfully present, including DACA recipients like Katia. And so I hope that we can all, if that is the agreement that we want to make for this bill, then that is a conversation that I'm willing to have, at least for covering those who are lawfully present, because clearly there are cases, as Katia, as we were able to mention earlier in the presentation. But beyond that, right, regardless if they're here lawfully present or not, we are talking about kids with cancer. Avoid the conversation of the politicalness of the semantics and everything that we put forward, right? These are kids with cancer. They are in a situation where they have been deemed either in a life-threatening case or terminal. Parents in this scenario have to prepare for either readmitting their kids back to the emergency room or preparing for their funeral. That is the situation that we're talking about today. Regardless of the services that are already being offered, the taxpayers ultimately still have to pay for it when they come into the emergency room. All we're asking is for the continuation so that it's improving the quality of care for the patients that need it most and fundamentally providing a pathway for them to live. That's all we're asking, so that they can become the next Ruby. And if they're afforded the opportunity to become U.S. citizens or to be here lawfully present over the period of time, we can at least alleviate the concerns for when they get that moment. And that's what this bill does. And so I thank the Vice Chair for allowing me the chance to present this bill.